Good evening. Welcome to this evening's panel discussion with Dr. Dariush Mozaffarian, who has led the White House Conference on Hunger, Nutrition, and Health. Dr. Dariush, thank you for joining us today at the Harvard Food Systems Initiative's work, whose purpose is to convene experts from various fields of health and well-being from around the globe and share information with our campus and beyond. In September 2022, the Biden administration hosted the second White House Conference on Hunger, Nutrition, and Health. The conference goal was to end hunger and increase healthy eating and physical activity by 2030, so that fewer Americans experience diet-related diseases like diabetes, obesity, and hypertension. Dr. Dariush Mozaffarian of Tufts University co-chaired an independent task force which aimed to help catalyze and lay the groundwork for the conference and is now supporting the subsequent national strategy and policy designed to help end hunger and reduce diet-related diseases and disparities. Dr. Dariush Mozaffarian is a cardiologist, Jean Mayer Professor at the Friedman School of Nutrition Science and Policy at Tufts University. He's a professor of medicine at Tufts School of Medicine and an attending physician at Tufts Medical Center. His work aims to create the science and translation for a food system that is nutritious, equitable, and sustainable. Dr. Mozaffarian has authored more than 500 scientific publications on dietary priorities for obesity, diabetes, and cardiovascular diseases, and on evidence-based policy approaches and innovations to reduce diet-related diseases and improve health equity in the US and globally. Some of his areas of interest include healthy diet patterns, nutritional biomarkers, food is medicine, interventions in healthcare, nutrition innovation and entrepreneurship, and food policy. He's one of the top cited researchers in medicine globally, and he has served in numerous advisory roles, and his work has been featured in an array of media outlets. Dr. Mozaffarian received his BS in Biological Sciences from Stanford University, MD from Columbia University, and doctorate in Public Health from Harvard University, and additional clinical training in internal medicine at Stanford University and in cardiology at University of Washington. Today, I'm really glad to have Dr. Mozaffarian join us. Dr. Mozaffarian, over to you.
Thank you so much. So nice to be speaking with all of you. As was mentioned, I received my PhD from Harvard in 2006, and I was on the faculty at Harvard School of Public Health and Harvard Medical School for about a decade before moving to Tufts. So I have a great fondness for Harvard, where I really built my initial career. And I'm going to be talking for about 25 minutes on the White House Conference, for those of you who didn't hear very much about it, to give kind of a background. And what I was asked to talk about is how we were involved and what we were thinking in thinking about why we needed a White House Conference and how to help inform the White House Conference. So, first, why have a White House Conference? Well, because food is really, I think, one of the single biggest issues facing the nation today. We spend a lot of time talking about other issues, but if you put all of the challenges and opportunities together, I really think that the food system is, definitely in the top three, and maybe even the single top opportunity and challenge facing the country today. First, there's still a lot of hunger and food insecurity in the United States. About almost 40 million Americans, including 12 million children, live in food insecure households, meaning they're not exactly sure from month to month or from day to day even where they're going to get their next meal. And that is about 1 in 10 of all households. And these challenges affect every state, rural and urban households and across political perspectives, but they're particularly worse among rural areas, for Americans with lower incomes, and in specific racial and ethnic minority groups, particularly Blacks and Hispanics. And so there's both, pretty dramatic food insecurity, 1 in 10 households, and pretty dramatic disparities in that insecurity. There's also, beyond food insecurity, very, very poor nutrition. We are failing nutrition. If you look at the Healthy Eating Index, which is a marker of adherence to the dietary guidelines, 100 would be perfect adherence to the dietary guidelines. Our average score in our country is 58. We are failing. 58 is an F. We are failing dietary guidelines. And if you look by age, the diet quality is worst in youth, which is really, really problematic, because this is where we want to set up the healthiest diets. And there's not a single age, sex, racial, ethnic, or income group that has an average score above 65. So this is really a problem across the entire country. We really have very poor nutrition. And this is leading to enormous disease that just shocks me that we don't have on the front page of the newspapers every day. More than 500,000 deaths every year are directly attributable to poor diet. 9 in 10 adults in the United States have suboptimal cardiometabolic health. 7 in 10 have overweight or obesity. 5 in 10 have diabetes or prediabetes. 6 in 10 have at least one chronic disease, and 5 in 10 have cardiovascular disease. It's rare, it's unusual to be healthy. The vast majority of American adults are sick, and most of this is from diet-related diseases. And this starts young. Even among teenagers, 1 in 4 have prediabetes, 1 in 4 have obesity, and 1 in 4 have fatty liver disease. And much of this has just happened in the last 30 years, in just 30 years. So this is an incredible problem. And like hunger and food insecurity and poor nutrition, there's incredible health disparities with even higher rates among those who have lower incomes or in rural areas or in particular racial and ethnic minority groups. Now, this is leading to incredible rising costs. And so today, look at the chart of rising costs of Medicare and Medicaid, this incredible rising costs of healthcare. 86% of US healthcare spending is for chronic diseases, many of which are diet related. Today, it's about almost $1 in $5 in our entire economy is spent on healthcare. And that's $1 in $3 in the federal budget. And if you put together the healthcare costs and lost productivity, the food system is estimated to cause $1 trillion in economic losses every year. And so we spend about $1 trillion on food. And so for every dollar we're spending on food, our economy is losing $1 due to poor health. This is really a horrible economic proposition. And it's also straining military readiness. And it's important to talk about that because this isn't just a progressive issue for kind of blue states. This is hurting our military. 8 in 10 young Americans don't qualify today for military service. And among the reasons, the top medical reason is excess weight. And there's a terrific group called Mission Readiness with whom we work that includes almost 800 retired generals and admirals. And they put out a series of reports talking about how poor nutrition is a major national security threat. This is one report called Unhealthy and Unprepared. And as General Richard Myers, the 15th chairman of the Joint Chiefs of Staff said, basic training lasts weeks, but building strong troops takes years. Encouraging healthy lifestyles early in life will help our nation prepare for future challenges. So if you put together the food security challenges, the nutrition challenges, the diet-related disease challenges, the economic costs, and the strained military readiness, this is a major, major problem for our country. And we haven't even added the sustainability issues that some of you know so well. Beyond that, there's actually very positive potential here to unlock business innovation. 1 in 10 US jobs, 1 in 10, are directly supported by the food and agricultural sector. This is a huge supporter of jobs. It contributes, as I said before, about $1 trillion to the nation's economic output and about almost $200 billion in exports. And this is also great for reducing disparities because food sector businesses are the #1 source of new small businesses and new jobs in racial and ethnic minority communities. And consumers at the same time are demanding healthier, more authentic, more nourishing food. So there's really potential here to actually create jobs and boost our economy. So we need the whole country to actually get together and focus on food. I mean, if I go through all of those statistics, you would think that every congressman, every senator, every president would be talking about these issues, the hundreds of thousands of deaths per year due to poor diet, the $1 trillion loss per year in healthcare spending and lost economic output, the incredible strains to military readiness and so on. But mostly our government hasn't been paying attention until recently. And so that's why we really need to have national focus. The last time this was done, the last time the federal government as a whole had focused on nutrition was in 1969. The 1969 White House Conference on Food, Nutrition, Health was organized by Dr. Jean Mayer. Jean Mayer is shown here in the glasses. Jean Mayer was a nutrition scientist at Harvard at the time. He went on to become the president of Tufts and founded our school. And as mentioned, I'm the Jean Mayer professor at Tufts. He went to President Nixon and said, we have a serious hunger problem in the country. And Senators George McGovern and Bob Dole, a powerful Democrat and a powerful Republican, supported this. And so President Nixon convened this conference in 1969, mostly focused on hunger, which at the time was really about long-term lack of calories. There were families and children with emaciated arms and distended bellies in the South in particular, images of hunger that you just wouldn't dream you would see in the United States was happening in the 1960s with really severe caloric hunger. And so that conference really put in place all of our modern food policy. It led to major expansion of the food stamp program. It led to major expansion of the school lunch program. It led to creation of the WIC program, which feeds babies, pregnant mothers and babies in this country. 1 in 2 pregnant mothers are on WIC. It led to creation of the school breakfast program, which was modeled after a Black Panthers program. It led to creation of the Nutrition Facts Panel, and it led to creation of the modern dietary guidelines for Americans process. So really all of the stuff we think about when we think about our modern food policy came from that 1969 conference. But of course, today we face very different problems. We don't have that severe long-term caloric hunger anymore. We have industrially produced food and processed food. And so we have a 20th century food system that was built to solve the problems of the 20th century, which was to get enough vitamins and get enough calories to people, but we have 20th century problems. So we needed a new White House conference. And so when I arrived to Tufts now 9 years ago, I learned all this history. I learned the history of Jean Mayer, and I looked at the challenges before us, and I said, we really should try to engage with the White House to try to have another White House conference. And so we engaged with President Obama and First Lady Michelle Obama for several months, and we tried 9 years ago to convince them to host a White House conference. It was the last 2 years of the Obama administration, and he was really focused on immigration and jobs. And so at the end of the day, I would guess we got maybe 60% of the way there, but we couldn't convince President Obama to host a White House conference on food and nutrition. When Trump was elected, we sort of put a pause on working directly with the White House because the Trump administration was more unpredictable. But we started working with Congress more closely, with the House and the Senate, and with the agencies directly, and really trying to galvanize attention toward a White House conference. And in 2019, 4 years ago, at the 50th year anniversary of the White House conference, we co-hosted with Harvard School of Public Health and Frank Hu, we co-hosted a celebration of the 1969 White House conference to raise attention, and we invited congressmen and other policy leaders to come and hear about the achievements of the 1969 conference, so that we would try to get this into kind of people in government thinking about this. And then when President Biden was nominated, not even when he had won, but when he was nominated for president, and was still running for president, and we thought he had a good chance to win, myself and my friend Chef Jose Andres started reaching out to his team to make the case, even before he was elected, that we needed a White House conference. And we put together an informal group, which turned into a more formal group, a task force led by, co-chaired by Chef Jose Andres, by Ambassador Earthren Cousin, the former head of the World Food Program, by Senator Bill Frist, who's a former senator, former Republican Senate Majority Leader and cardiovascular surgeon, and Secretary Dan Glickman, who was a former Secretary of Agriculture, to try to engage with the White House and also with Congress to help encourage and stimulate a White House conference. Now, many others did this as well. The biggest champion in Congress was Congressman Jim McGovern, who's been talking about this for years. And he was really instrumental. Without Congressman McGovern, that this wouldn't have happened. But I think that we also played a really important role in helping to convince the White House and the agencies that this was important. And starting about 18 months ago, the Domestic Policy Council, led by Ambassador Susan Rice, started looking at this, considering this, bringing the agencies together, saying, look, if we brought all the agencies together, what would we do, and how would we host a White House conference? What would be the topics? What would we focus on? And we worked to inform that. We ultimately ended up putting together an independent task force, not something that was put together by the White House. I want to emphasize an independent task force led by these co-chairs to put together recommendations to have the White House conference, and then what we felt the White House conference should focus on. And the report is here at our website. I really encourage people to read it because it's the best, I think, multi-stakeholder bipartisan report on US food policy that's been published in the last 50 years. And so we really wanted to have a broad multi-stakeholder consensus driven process. And so we had 26 task force members, which I'll mention. We had 26 strategy group organizations that informed us. We held 16 listening sessions with in communities around the country with individuals typically from low income or marginalized backgrounds who had lived experience in food insecurity or diet related disease or poor nutrition to hear their perspectives. We held 3 national policy convenings with about 100 experts each, one with Mayor Adams in New York City, one with Kaiser Permanente in Oakland, and one with the Bipartisan Policy Center in Washington, D.C. We solicited over 75 published policy reports from other organizations to see what had been published. And we put all that together into a final report, which has 6 domains of action, 30 policy recommendations, and under each of those policy recommendations, very specific recommended actions. Our task force members are listed here and in our report. It really represents a cross-section of the nonprofit community, the clinical community, the military community, private business, healthcare, insurance, nonprofits, chefs, really a range of expertise, doctors to farmers to think through what are the top recommendations for fixing food in this country. We also had a strategy group of major national nonprofit organizations that didn't sign off on the final report, but didn't approve it per se, but gave us lots and lots of input and guidance on the final report. Really terrific group of organizations who really helped provide the report. And so again, the final report is here. We focused on all 3 conference goals: hunger, nutrition, and diet-related chronic diseases across 4 White House pillars: improving food access and affordability, integrating nutrition into healthcare, empowering consumers, and enhancing scientific research. We really centered the whole report on thinking about the perspectives of individuals with diverse lived experience in these issues. We really wanted to be sure that everything we recommended was evidence-based and actionable. And we prioritized what we call double or triple duty actions, actions that could give benefits across multiple conference goals and pillars. So not just addressing hunger, not just addressing nutrition, but addressing both. And so here is a kind of a schematic of our 6 domains and some of our 30 priority policy recommendations. The 6 domains were to improve the government nutrition programs, to advance public health and education, to integrate food and nutrition into healthcare, to advance science and research, to advance business innovation, and to advance national coordination. And I think what's exciting is we sent this report to the White House a couple of months before the conference, and most of our recommendations, especially in these domains, the first 4 domains, made it into the final report. Many others gave their input as well. So again, it wasn't just us, but I feel like we had a positive influence on the final report. I'll just give you some examples. I mentioned there's 30 policy recommendations. Here's an example of 5 specific policy recommendations under healthcare, integrating nutrition and health. And so first, to accelerate access to food as medicine services like produce prescriptions and medically tailored meals. Second, to increase access to an insurance coverage for behavioral interventions and nutrition counseling. Third, to build a diverse healthcare workforce with appropriate training and expertise in diet and health. Fifth, to facilitate screening for food and nutrition insecurity in the electronic health record. And last, to leverage the role that hospitals play in their communities to help them become a hub for healthy regional food systems. So those are kind of the top level policy recommendations. And then importantly, we got very granular because we wanted to help the agencies and the White House and Congress know how to translate this into specific actions. And so here again, under policy recommendation number 13, accelerating access to food as medicine services, we kind of gave our vision, we kind of talked about what we wanted to do, but then we gave very specific examples of action. And so for example, we said CMS should promote existing opportunities to test these food as medicine interventions in Medicare and Medicaid through these specific waivers that are allowed, Section 1115, 1915B, and other waivers that allow Medicaid and Medicare programs to test these recommendations. So we were very, very granular to try to help make these things as actionable as possible. As another example, we recommended policy, our 27th of 30 recommendation, to increase the number of new small and mid-sized farmers growing specialty crops, fruits and nuts and beans and vegetables and other foods recommended by the dietary guidelines. And then we gave very, very specific policy actions. So we recommended the creation of PharmaCorps like AmeriCorps or Teach for America. We recommended allowing specific access to specific USDA grants and loan programs and other incentives. We also recommended a lot around business and innovation. And this was one area where the final national strategy that was released by the White House didn't have a lot of what we recommended. It had some things, but not as much. And so this was a little disappointing. I think the government has an incredible role to play to advance innovation in the food sector. The government is doing it now for clean energy. The government is doing it now for silicon chips and producing silicon chips. The government has done it historically for cars and for railroads and for many other sectors of the economy. It's time to have a national strategy to promote business innovation and entrepreneurship. And so we had very specific recommendations around that. And again, this was a little bit more disappointing that not all of these were in the report. We also put together, beyond all the work that we did, we put together a terrific coalition of almost 100 organizations who broadly supported these goals and these recommendations. Groups including for-profit companies, nonprofits, academic organizations, foundations, the NAACP, American Diabetes Association, many other organizations. And this was really important to show the White House and Congress that there was really national interest in these issues. And we were so delighted that on September 28th, as was mentioned last year, the president opened the White House conference. It was attended by cabinet secretaries, by senators, by congressmen, by business leaders, nonprofit leaders. And what was important was not the day itself. The conference itself was just a day to kind of bring people together. What was important was the national strategy. The White House over the last year had worked on a very, very ambitious, very specific, very actionable national strategy. And so I encourage all of you to go to the White House and look at the national strategy. It's excellent. It's an excellent national strategy to deal with food insecurity, poor nutrition, and health in this country. And the White House is actively working on implementing the national strategy through Health and Human Services, through USDA, through the CDC, through other things. Many things are going on, and hopefully in the question and answer we can talk about some of those items. But this really has already started to move the needle. As examples, in the national strategy under healthcare, here are some of the top priorities that the White House has outlined: to increase medically tailored meals and produce prescriptions and RDN counseling for obesity and Medicare and Medicaid; to test produce prescription pilots in the Indian Health Services and in the VA hospitals. That's already starting to happen. To increase nutrition education for doctors, and I attended a meeting in Chicago on this just a few weeks ago. I can talk about that if people are interested, and much more to really be sure that food and nutrition is finally actually integrated into healthcare. This is just one example. Now, the White House also recognized that the federal government can't do this alone, so they called on states and businesses and foundations to make commitments toward advancing this. And this is just some examples of commitments made in September. Kaiser Permanente, the largest HMO in the country, committed $15 million to expand their food as medicine program. The Rockefeller Foundation and American Heart Association committed $250 million, $250 million to advance food as medicine research. The American Academy of Pediatrics is going to offer training to 67,000 pediatricians on how to screen and refer patients for issues around nutrition, and so on. So there's a lot going on with new commitments. And just on Friday, the White House held an event in DC asking for more commitments this year. And they're every year going to ask for more commitments from the private sector and foundations on how to move forward this national strategy. So what are we doing now? You know, we were very happy that the White House conference happened. We were happy that there's a national strategy. After the 1969 conference, some of the things were implemented in the first 2 years. Other things took several years to implement. And so we realized that just having a plan doesn't mean it's going to be implemented. There's going to have to be continued effort. And so we've actually accelerated our actions, accelerated our advocacy, our outreach to agencies, our outreach to the White House, our outreach to bipartisan leaders in Congress. We're convening the private sector and nonprofits around food and around healthcare. We're trying to communicate and disseminate these issues to media and the public, because at the end of the day, the national strategy is just a piece of paper if it doesn't get implemented. And so we really want to be sure it's advanced. And at Tufts, three of the things we're focusing on, although we support a lot of things in the national strategy, is food as medicine interventions in healthcare, advancing nutrition security in the federal nutrition programs, SNAP, school meals, and WIC, and advancing nutrition science at NIH and USDA. So really happy now to have some discussion, and you know, we have, I think, half an hour to hear from everyone and talk about any of these issues, including more details on what's going on now.
Thank you so much, Dr. Mozaffarian, for that overview and deep insights that you've shared. In my role, I probably should have started with an introduction about me, and right. I'm Smita Hanif. I serve as the Managing Director for Harvard University Dining Services, and I serve as the co-chair for Harvard Food Systems Initiative, along with Dr. Walter Willett. And clearly, the aspect of food systems, nutrition is a critical, important factor and work that we do here. And in listening to you, Dr. Mozaffarian, you spoke about the cross-section of demographic within the country, and you did speak about institutions and how we can engage as well. Can you share about your thoughts and ideas of how institutions of higher education, we have anywhere from 17 to 19 million students across this country, could engage in this work, whether it is the 6 domains or the national strategy itself? They could propel and advance and be the translators at a much faster pace. What ideas might you have for people like me or institutions of higher learning?
Well, I think it's absolutely critical. I think there's you know, 2 major categories of actions. There's things that the institution can do themselves around their own issues around food, and there's advocacy and education and knowledge transmission to policy leaders and to the private sector to get them to do those things. And so first, you know, the things the institution can do internally. So institutions such as Harvard, of course, have food, and so thinking about the kinds of food that are purchased and served on the campus, where those foods come from, they're not just their nutritious quality, but how they're supporting small local and regional businesses, you know, sustainable practices, and equity in ownership of the businesses that they're coming from. That's very, very important, and that's challenging. And I know you've thought a lot about that and had a lot of leadership on that at Harvard. It's challenging because historically everything's been the lowest price. Like, how can we get reasonable quality at the lowest price? Because of cost is a big challenge. But we have to figure out how to move beyond that and not have it just be based on cost, but also on nutrition and sustainability and practices. Second, you know, there is food insecurity among students, right? Not students have food insecurity. And so ensuring that students are connected to resources, whether they're state resources or federal resources or other institutional resources to address food insecurity. You know, third, to be sure that there's appropriate nutrition and food systems education across the campus, so that in every school, in every program, there are courses, there are faculty that are teaching those things. When the White House conference asked for commitments last year, the Friedman School made public commitments around these issues, around our procurement, around our faculty recruitment, around the courses we're going to teach, around how we're going to think about these issues. And so I think all of those things, you know, your teaching, your procurement, your faculty recruitments can highlight these issues. And then I think second, as I said, both the individual students and the faculty and the institution as a whole can also advocate. And that's actually typically not done by universities. Universities typically don't like to advocate or to lobby for different policies. They feel like we're not supposed to do that. We're supposed to publish the science and educate people and let other people take that. But I think that's too passive of an approach. And our school was founded by Jean Mayer, who said, nutrition is not a discipline, it's an agenda. That's his famous quote in our lobby of our school, because Jean Mayer realized that you could do all the nutrition science you want, but if it's not translated right, it's not going to be helping people. And so he really went and spent his time and effort and reputation to go to government and make a change. And so I think that requires the institution, not just the faculty, to do that. And we're doing that at Tufts. And then lastly, especially for students, first educate yourself on these issues, learn about these issues, but also you're all voting age, unless you're super, super brilliant and you're 17, you're all voting age. And so you should all contact your elected federal officials and tell them this is important to you. It makes a huge, huge difference. If a phone call, when they get a phone call from one of their constituents saying, I heard about the national strategy, I heard about these goals, I think this is really important, I want it to happen.
Great. Thank you. Thank you for those insights. Food systems, people, health of people and planetary health are so interconnected. In fact, one of the first sessions when we met was at a similar conference. How has this conference addressed climate? Because I know climate comes up when I talk to students here and at other campuses. What do you see as the intersection that you might want to share with the audience?
Yeah, well, so food, of course, is the single biggest sustainability issue on the planet. It's about 25% of climate change emissions are from the food sector. And if you add the opportunity cost of what we're not doing with land that we could be doing to help, use land as a carbon sink, it's maybe even more than 25%. 70% of the world's fresh water use, 90% of tropical deforestation, 50% of ocean pollution is due to the food system. So it's the biggest sustainability issue on the planet. There were folks that were critical of the White House conference that it didn't focus on sustainability. And I think that's a mistake. This is a huge, huge lift to get the government to focus on hunger, nutrition, and health. That's really complicated. If you look at the issues, the challenges already really complicated. And when we spoke to the White House early on, even before the White House conference was announced, they said, look, we can't do everything for everyone. Another issue that wasn't addressed was international nutrition, right? This was very domestic focused, right? There were people that said, look, we have to focus on international hunger and strife and humanitarian crisis, which is a big part of what we study at Tufts as well. And the White House said, look, if we want this conference to be meaningful, if we want it to have actionable recommendations, we have to focus. We can't do everything in one conference. And so I think that was the right choice ultimately, because again, if you look at the national strategy, it's already incredibly complicated. So I think that was the right approach to be as focused as possible. But that doesn't mean that the national strategy can't start to think about sustainability issues and international issues, and that we can't then start to advocate for a food systems summit to think about these other issues in follow-up. And as just one example, in both our advocacy around the national strategy and in our input into some bills that are being drafted in Congress, one of the things we've said is, for example, if there's going to be a USDA or Medicare or Medicaid produce prescription program where the USDA or Medicare or Medicaid pays for healthy fruits and vegetables, that they should consider in their procurement small and local regional farms. They should consider sustainable practices. They should consider BIPOC ownership, not just lowest price. So that's one way to start to integrate those important issues into the national strategy now.
Thank you. So the conference happened on September 28th. This is a two-part question. Is the intention to have an annual conference? And the second part to that is, how do you hope in your leadership position to maintain continuity to the wonderful work that's been started, right? You've catalyzed the country beyond, right, behind this movement. But what would continuity look like, and what do you see as, what do you hope to see as results for this conference that started last year?
Yeah, well, so first, thank you for saying I catalyzed the country. I would say I helped catalyze the country, but of course there were a lot of people who worked on this, and I think again Tufts had an important, a critical role, but definitely not the only role. There was a lot of people that provided input to make this happen and make this a reality. I think that first, the goals are to achieve all of these things to end very low food insecurity and dramatically reduce low food security, to improve diet and to reduce diet-related diseases by 2030. So 7 years from now. So that's the goals of the national strategy. The Biden administration right now has less than 2 more years in office, depending what happens in the next election. And so they are working very, very hard across every agency to implement as much as possible at the agency level that doesn't require actions by Congress. And so a lot is going on at USDA, a lot is going on at NIH, a lot is going on at CDC, a lot is going on in Medicare and Medicaid and other agencies to try to move the plan forward. Second, there are congressional leaders who now see the national strategy and have also been catalyzed and interested. And Congress is very hard to pass laws when there's all the bipartisan arguing. I think a lot of that arguing is because healthcare is swallowing up the whole budget. 50 years ago, 5% of the federal budget was spent on healthcare. Today, 33%, or sorry, about 30% of the federal budget is spent on healthcare. So healthcare is swallowing up all the federal budget, not allowing people to do anything else. But I think that we're trying to work with Congress to help make things happen. And so, the short answer to your question is I don't know for sure, because I'm learning, right? I'm not a policy expert. I'm not a politician. I'm a cardiologist and faculty member and dean at a school. And so I'm learning as I go. But I have found that if the most important thing is to connect the dots. And so when you talk to a business and a business cares about, a food business cares about healthy nutrition because they're trying to make healthier food, they want to market. Or you talk to a farmer and a farmer cares about nutrition because they want to do good for people. Or if you talk to a healthcare company and they care about nutrition because they're rising healthcare costs. Or you talk to a business leader who says his employees have or her employees have reduced productivity. Or you talk to a general or an admiral who says we can't recruit healthy young Americans into the Army anymore. So if you connect the dots and you start to bring together these traditionally siloed groups, a lot of people care about food. A lot of people care about food. And yet those groups have much smaller voices than other voices, in Congress, voices around important issues like HIV or Parkinson's disease or silicon chips or China or anything else you could think of, right? COVID, opioids, those are all important issues too. I think food is a bigger issue than any of those. And so I think if we can connect the dots and keep up the energy and the momentum, hopefully it will extend beyond the Biden administration into future administrations. But it's an experiment. I don't know. I will have to see what happens.
That's great. They say it's the time for grand experiments. So absolutely. We have a few questions here in our Q&A. The first one is from one of our food literacy project fellows, Yabi Abeji. And her question is, are there other countries that you consider exemplars for policy in food system or any pieces of legislation that you think we should adopt in the USA?
There are lots of pieces of legislation I think we should adopt, and they're laid out in our strategy. So I'll maybe mention a couple, but there's many pieces of legislation we should adopt. But to go back to the first question, I get asked this all the time: are there any countries that are exemplars? No, absolutely not. We've had the wrong approach to food. Well, let me rephrase that. We've had a 20th century approach to food. The 20th century was a time we have to just step back 50, 60 years and put our minds in the time of the 20th century. The priorities were completely different. There wasn't an obesity epidemic. There wasn't a diabetes epidemic. There wasn't a mental health epidemic. There wasn't any understanding of the microbiome or gut health. There wasn't any understanding of food and nutrition and immunity. The goals of the 20th century were to get vitamins to people, because vitamin deficiency diseases were very common in the United States and in Europe. They were very common. Diseases like pellagra afflicted 80% of Black children in New York or in London in the 1920s. So we wanted to get vitamins to people. And there was tremendous concern over global starvation. 28 million people starved, died of famine during World War II. 28 million people. We think of Ukraine as disrupting the food system. It's nothing compared to what happened in World War II. 28 million people died of famine. And there was concern because of the rising world population that 1 billion people might starve before the end of the 20th century because we didn't have food supplies. And so that led to the Green Revolution, the industrial monocropping of crops, pesticides and fertilizer, and incredible increases in yields of corn and rice and wheat that prevented mass starvation. So we had what governments did up until 20 years ago was all focused on vitamins and calories. Now, in the last 20 years, some governments have started to shift to think about chronic diseases. How do we, now that we've basically more or less helped avoid mass famine and we've helped reduce vitamin deficiency diseases, what do we do for chronic diseases? And I think the mistake that most governments are making so far is they're using what I call the tobacco playbook. The World Health Organization 20 years ago published the tobacco framework, the Framework Convention on Tobacco Control, which laid out how to control tobacco. And it's restricting marketing, putting on warning labels, and taxing tobacco. And most governments, that's what they're doing. They're putting on warning labels, they're taxing, and they're trying to restrict marketing. That works for soda. It's great for soda. Maybe it works for junk food, but then it stops working. You don't increase fruits or increase nuts or increase seafood through restrictions on marketing and taxation and a tobacco playbook. We have to totally shift the way we approach food. So I don't think any country yet has a real plan. This national strategy is the best plan I've seen. So actually the US, in terms of its own plan, is leading the country right now. And then in terms of specific legislation, just for time, I won't go into all the details, there's lots, but I think, two things I would love to see. Number one, that requires Congress, I would like to see a National Institute of Nutrition at NIH. The NIH is the world's leader in research, in education. It has 27 centers and institutes. None of them are on nutrition. And so the top cause of poor health is missing from the National Institutes of Health. And so we need to have Congress create a National Institute of Nutrition at NIH. And we have a whole paper we've written on that topic. And then secondly, we need to have someone in charge in the White House organizing all of this. Right now, it's being organized by the Domestic Policy Council, which is excellent, but there's not a senior official entirely in charge of food and nutrition. And so we need to have a new Office of Food and Nutrition, or a new Director of Food and Nutrition Policy in the White House, who sits at the cabinet, sits in the National Security Council, and provides leadership. And the analogy for that would be the Director of National Intelligence, who was created about 20 years ago to oversee national intelligence. And so I think those are the two things I'd really love to see, if I could sort of wave a wand.
We will be right there supporting you, right, in as you're building up this agenda. The next question is from Artha, and the question is, could you speak more to nutrition education? How can medical schools better prepare future physicians in the realms of nutrition and dietetics?
Yeah, well, this is what got me into this field. People ask me, how did a cardiologist become the dean of a school of nutrition? How did I become interested in food and nutrition? And I say, shouldn't every cardiologist be interested in food and nutrition? This is the top cause of cardiovascular disease in the world. And so it's missing from medical school, most medical schools. And when I was at Harvard as a faculty member, the medical school had 4 hours of required nutrition education at Harvard Medical School. Now it has zero. There's an elective that you can take, taught by Chris Duggan, which is excellent, but it's an elective. At Tufts, because of our School of Nutrition, we have 24 hours of mandatory nutrition education, which is one of the tops in the country, but most medical schools have zero. And so we've written about this, others have written about this. Harvard Law School has an excellent report on this. The way to change this is just to change the tests. If you change the US medical licensing exam, which all physicians have to take to get their MDs, if you change the American Board of Internal Medicine exams, which people have to take at the end of their specialties, if you change the continuing medical education requirements, which all practicing physicians have to do every year to maintain their licenses, and if you change the accreditation requirements for medical schools and residencies and fellowships, there's an accreditation body to require nutrition education, all the programs will change. They'll all change overnight because they'll want to teach, they want people to graduate. And so that's the way to do it. And fortunately, the ACGME, which is the Accreditation Council for Graduate Medical Education, which accredits all of the programs, the AAMC, which is the American Association of Medical Colleges, and the AAMOC, the American Association of Medical Osteopathic Colleges, held a meeting in Chicago just a couple of weeks ago to talk about this very issue. How can they as a group together advance nutrition education? And they invited me to come, and I spoke at that event. I think we're at a potential tipping point with the ACGME and the AAMC. I think they could be convinced to make nutrition education, some reasonable nutrition education, a mandatory part of medical education. I think right now they're on the default softer path, which is just to give guidance, not to make it mandatory. But I hope they make it mandatory. And we don't need to turn doctors into dietitians. They don't need to become RDs. But if I order an MRI, I have to know what an MRI is, how it's used, who it's indicated in, and what the findings mean. I have to know something similar about food and nutrition. I have to know when to order a produce prescription program, when to screen for food insecurity, how to get a basic sense of a person's nutrition, and how to use that information, just like I would use an MRI. I don't have to become an MRI expert, but I have to know how to use that tool. And food and nutrition is another tool. So I'm cautiously optimistic that this new effort by the ACGME and AAMC will bear fruit.
Right. Thank you for that overview and ideas. Two questions from two different guests, but both linked on the climate side. This is from Mauro Morabito and Anita Chandrahas, Anita is a food literacy program fellow and a graduate student with us. The question is, were there any policy outcomes considering holistic issues, including not only hunger and nutrition, but also other issues such as environmental justice, land use, water use, etc. And the second part to that, which Maura writes, is, could you speak about role of industrial animal farming in the US and the White House conference?
Yeah, so I think I already answered the first question that you asked me, that this conference was focused on hunger, nutrition, and diet-related diseases. Those are big issues, and that was the major focus. And so not on those other issues, but I think there is a way through some of the solutions to start to integrate that. But it was definitely not a major focus of this conference. And I think that's okay. As I said, you can't focus on everything and fix everything all at once. You have to start somewhere. I think that industrial livestock production is a significant problem for climate, and it's a significant problem for animal welfare. That's very clear, for water use, for land use, for other things. I do think that the intersection between nutrition and sustainability has been overemphasized. I think that there are some who say, if we just eat sustainably, we'll eat healthy. If we just eat healthy, we'll eat sustainably, and that's not true. And so, if we cut out the single biggest thing we could do to improve the environment is to cut out industrial meat production. Full stop. If we cut out industrial meat production, it would have an almost negligible effect on human health. It wouldn't almost do anything because there's not huge burdens of health of meat consumption. There's much bigger burdens from too little fruit consumption, too little vegetable consumption, too little seafood consumption, too few plant oils, many other things. And similarly, I don't love the term, a corollary to that is I don't love the term plant-based, because people say if we eat plant-based, it's good for the environment, it's good for the earth. It's good for the earth, but most of what's bad in our food supply is plant-based. All the processed wheat, all the processed corn, all the processed rice, all the sodium, all the sugar, it's all plant-based. And so the majority of our disease is caused by hyper-processed plant-based foods, not animal foods. So I guess that's not really an answer to the question, other than to say that we have to really be careful, because the same solutions for one problem don't always translate to the other problem. So again, if we want to cut out environmental consequences of food, we have and animal welfare consequences, industrial meat production has to be the top priority. If I wanted to tackle hunger and nutrition, diet-related diseases, industrial meat production wouldn't be in the top 10, right? There'd be other things that were much more important. So I think it makes it very challenging, but it makes it, these are big issues that are really important. So I think it makes it exciting to work on.
Okay, thank you. I'm going to shift gears and ask a little bit more personal question, right? You maintain an active lifestyle, you're into Taekwondo, and what does a day in the life of Dr. Mozaffarian's menu look like?
Well, so, I really believe in work-life balance. I think that's important. I have 3 young kids who are 10, 12, and 14, and a wonderful wife who works at Harvard School of Public Health. And so, my first priority is to be able to spend time with them and do things with them. And that's my biggest priority. I think, a second priority is to take care of yourself, because if you can't take care of yourself, you can't do anything else. And so to eat well and to exercise as much as I can, I think that's really, really important. And I try to exercise, 4 times a week or so if I can, although that doesn't always happen. And then after that, then comes work, and you just try to be as efficient as possible. And I think my work day is mostly deciding who I'm going to make less angry at me by being late to respond, because just too much going on. But I think if you're passionate about your work and you enjoy your work, then it becomes fun. And I think that's one of the terrific things about being in academics is if you're successful and can get the grants and projects you like, you can kind of do it. You can focus on the things that you really care about. And there's not a lot of jobs where you can focus on the things you care about. So I care about education and teaching young people. I care about research and advancing science, and I care about advocacy and changing policy. And you kind of get to do all those things in an academic career.
Great. Well, thank you so much. On that note, I'm going to ask the audience if there's any additional questions that you would like to pose. But really, really appreciate your time with us, Dr. Mozaffarian, in sharing about the big picture, the country level agenda, the 6 domains, and the magnitude of the work about why it is important here and now. We wish you the very best in your leadership journey as you set this agenda forward, and we look forward to your continued friendship and partnership.
Yeah, thank you so much. And I put in the chat the link to our website that has the report. I encourage everybody to read the report. It's worth, if you care about food, and then also look up the White House national strategy and look at that as well. Thank you so much. Very nice to talk to you.
Have a nice evening. Bye-bye. Thank you.